Hello, my name is Courtney Schuchmann and I'm a registered dietitian at the University of Chicago Medical Center. I will be reviewing an article titled Curcumin in combination with Mesalamine induces remission in patients with mild to moderate ulcerative colitis in a randomized control trial. This was published in February of 2015. The mainstay therapy for patients with mild to moderate ulcerative colitis is a combination of oral and topical mesalamine. A combination of the two has been shown to be superior to oral treatment alone. Failure to respond to optimization of mesalamine drugs often requires escalation to corticosteroids and/or immune modulators that carry potential side effects. Curcumin is a natural phytochemical derived from the Indian spice turmeric. It's been used in Ayurvedic and traditional Chinese medicine to treat various inflammatory diseases. It's been shown in vitro experiments to have anti-inflammatory and antioxidant properties. It's also been shown to be superior to placebo in maintaining remission in patients with ulcerative colitis up to 12 months. The aim of the study was to investigate the efficacy of curcumin as an add-on therapy with optimized mesalamine treatment for the induction of remission in active mild to moderate ulcerative colitis patients. Patients were recruited from 3 different medical centers in Israel, Hong Kong, and Cyprus over a 3-year period. Patients were included if they had mild to moderate active ulcerative colitis based on a simple clinical colitis activity index of greater than or equal to 5 and less than 12. They had to be between the ages of 18 and 70 years old with endoscopic or histologic diagnosis of UC. If they were on immunomodulators, they had to be maintained on a stable dose for at least 12 months prior to inclusion. Patients were excluded if they were on current or recent corticosteroids, if they were being treated with anti-TNF or cyclosporine, if they had abnormal lab findings, significant comorbidities like renal or liver disease, if they had C. diff or other active infections, and if they were pregnant or nursing. This was a multi-center, randomized, double-blind, placebo-controlled trial. Patients on maximal mesalamine treatment, which was a combination of oral and topical treatment, were entered into the trial. Those who were not on optimized treatment underwent a 2-week run-in period where they received 4 grams of oral mesalamine in addition to either a 1-gram enema or 1-gram suppository daily. Patients who still had mild to moderate ulcerative colitis based on an SCCAI score greater than or equal to 5 were entered into the trial. Patients were allocated to receive either 3 grams of daily oral curcumin for a month or placebo. Curcumin was given as 3 capsules twice a day before meals. At baseline and after 1 month of intervention, patients underwent physical examination and laboratory testing. Clinical status was evaluated based on SCCAI score, and consenting patients underwent sigmoidoscopy, and endoscopic activity was determined according to Mayo Index subscore. The primary outcome was the percentage of patients in clinical remission at 1 month, defined as an SCCAI score less than or equal to 2. Secondary outcomes were the percentage of patients with clinical improvement, defined as a greater than or equal to 3-point decrease in their SCCAI score. The rate of endoscopic remission, defined as endoscopic Mayo subscore drop of greater than or equal to 1 to a score of 0 or 1, the mean change in endoscopic activity score, and the rate of endoscopic improvement, defined as any 1 point or greater drop in Mayo endoscopic subscore. 97 patients were screened for the study and 50 were enrolled. 26 of the patients were allocated to receive curcumin and 24 were allocated to the placebo group. 3 patients were included in the intent to treat analysis but were excluded from the per protocol analysis. There were no differences between the 2 groups at baseline. 9 patients were treated with immunomodulators in addition to mesalamine, 4 of which were in the curcumin group, 5 in the placebo. However, there were no differences in outcomes between these 2 groups. It's also important to note there were no new laboratory abnormalities observed for either group. In the intent to treat analysis, clinical remission was achieved for 14 of 26 patients receiving curcumin and 0 of the patients in the placebo group. Clinical improvement was achieved for 17 of 26 patients receiving curcumin and 3 of the patients in the placebo group. Endoscopic evaluation was available for 38 patients, 22 in the curcumin, 16 in the placebo group. Endoscopic remission was observed for 8 of 22 patients receiving curcumin and 0 of the patients in the placebo group. Endoscopic improvement was observed for 10 of 22 patients receiving curcumin and 0 in the placebo group. The mean change in endoscopic subscore decreased for the curcumin patients and increased in the placebo group. In conclusion, the findings of this trial suggest that curcumin as add-on therapy with optimized mesalamine is superior to optimized mesalamine alone in inducing clinical remission in patients with mild to moderate UC. Limitations of the study are small sample size, the short duration of the study, and that there might be a dose response which was not assessed with this study design. Also, endoscopic evaluation was only available for 76% of patients, so ultimately further large clinical trials are necessary to evaluate the use of curcumin for inflammatory bowel disease.